However, even without the pandemic, workers can still be mentally impacted. An informal interview was done through WhatsApp with an Indonesian doctor currently working in Germany, where she stated that she had always experienced distress every time she handled difficult cases in ER. She stated, "At the beginning of my career, I always have anxiety every time I was going to ER for night shift." When asked if it was because of the fear that the patients' lives depended on her, she responded, "It's fear of doing something wrong." She also said, "Death is always difficult even though I've experienced it a lot." Like for example, I was working in a hospital which mainly treated breast cancer patients. I knew some of them were at the end-stage disease and they were gonna die soon. Even though everyone knew that we couldn't do anything anymore, it was hard to deal with death of patients, because it's sad. The patient's family is sad. I don't know, anyone with empathy would also feel sad. And when I made a bad decision, I reflected on it even after the shift ends and felt like a failure and just cried even though it wasn't a fatal decision. She also stated that sometimes the specialists were unreachable at night because they were asleep, but then I needed quick response. This also contributed to anxiety and also one of the reasons why I hated night shifts. Sometimes they were even mad at me for calling late at night. That gave me even more stress. These are the things that make me depressed sometimes. Despite all the distresses, these healthcare workers had found some ways to relieve their stress, especially during the pandemic. An article was posted by CNBC in which they mentioned that medical professionals have been doing TikTok challenges and dancing to keep their spirits up amid coronavirus chaos.